C V N Z C. Aí não consigo. Esse.
I'm Suzette Guina. I am a student of University Lurio. I studied optometry. This program is important because it's the first time to have optometry in Mozambique. I studied optometry here. I help the people of Mozambique to see this country. This country is amazing. It's a beautiful country.
My grandfather was blind, and it makes our relationship very sad because he never saw how beautiful we are or never saw directly our difficulties. He looked for helps many times around Mozambique and no one helped him. It was one of many reasons that makes me choose optometry.
In this region, we have one medical doctor for something like 50,000 people. And we don't have any optometrists for 20 million Mozambicans. I think that taking from this background, we know how important it is to train some optometrists in Mozambique.
Blindness really and poverty for me, they're inextricably linked. They're one and the same. If you don't have proper eye care, if you don't have good quality vision, then you become vulnerable. Blindness really is just a barrier to proper human development, which is about the right to education, the right to opportunity, to social and personal development, to employment, and ultimately it's about the right to life.
This major has a new future for our country, and I face it like this. Okay, this is the greatest, I will do it.
The basic concept is to try and address the eye care needs in developing countries, which are typically very underserved. And the thing about blindness and visual impairment is that the majority of it, at least 80%, is avoidable, or at least readily treatable with the appropriate services. So Unilurio is a new university in Mozambique and was keen to develop a health sciences faculty, and as part of that they agreed to launch an optometry program, the first optometry program for Mozambique.
Well, we've known about the Mozambique Eyecare Project for a good few years now, since it was set up, because we were in college at the time. And then when this opportunity came up, it was something that I really didn't want to miss out on, so we're going to go and help with the paediatric screenings.
No problem. No, Fiona, yeah? Will you send me over your patient after just to test this guy?
Optometry isn't just about working in one place, seeing people every day. We also have a responsibility as eye care professionals to the people who we can't see, to the people who can't see in developing countries.
This week, with the students from DIT and the students from Unilurio working side by side, I think that was quite special because DIT students being fourth year, they're nearly qualified. So you could see the Mozambicans watching them and even just picking up techniques from them or just little things to do to make sure they're providing a good quality service to the patient.
So we had a little station where the kids came in and they gave their name so we could keep track of everybody. And then the children went to the screening stations and we screened the kids with the Unilurio students as well. The Unilurio students were really helpful. It was great because they could talk to the kids in a way that we couldn't, and they explained to the children what we were doing and why they were there.
This is good for Mozambique because helping the children write better, see better, and read better. Make Mozambique one country with more opportunities.
On the days that we couldn't screen, we helped the Uni Laureate students with their clinical techniques. So the third semester, they hadn't started ophthalmoscopy or anything like that. So we practiced ophthalmoscopy with them and we showed them how to do it. And they loved that because it was possibly their first time looking in to the back of an eye themselves. They were mad to try it out then in the screenings on the little kids, and they did, and they were very good at it.
My favorite part of this course is optometroscopy. I do, and first time yesterday I see a macula, fovea, cornea. It's amazing.
Part of the role of academic institutions is community engagement. Here in Uni Laureate, the One Student, One Family program takes it to a whole different level. It's really an amazing program that sends students of medicine, of pharmacy, of optometry, dentistry, human nutrition out into the community. Students are assigned to a family for the semester, and there's probably something like 500 families that are being attended. That's fantastic in itself, but if that family passes on some of that information to their neighbours, friends, or whatever, there's the capacity there for some real sustained and wider impact.
In everything that we do in our life, we need to see what we are doing. If you want to pick up something, you have to see where is it. If you want to go anywhere, you have to see the streets of the places where you are walking around. Eyes, or health of eyes, it's important in everything.
Joel and Suzette will make amazing optometrists. They are keen to learn, motivated. They see the scale of the problem, and it's obvious that they think about the problem. And that makes me confident that they will have a career in optometry which is not just about the basic delivery of refraction, eye care services. Along with their counterparts, their fellow students, they will drive the profession and they will help to build a profession.
In the future, I want to open one clinic of the optometry for help more people of my city, Beira.
By coming over to Mozambique and actually setting up a college course so that Mozambique itself can help themselves to sort out this problem. It's not just Irish people coming in, helping out a little bit and going home. They're actually making it so that Mozambique can actually do it themselves eventually.
Agora